I'm Dr. Robin Miller, and you're watching Health Days conference coverage exploring research with the world's leading medical professionals. With the theme of advancing science and improving care, ID Week 2023 explored the latest science and bench-to-bedside strategies for prevention, diagnosis, treatment, and epidemiology of infectious disease. ID Week is the joint annual meeting of the Infectious Diseases Society of America, the Society for Healthcare Epidemiology of America, and the HIV Medicine Association, the Pediatric Infectious Diseases Society, and the Society of Infectious Disease Pharmacists. Today, you'll be hearing from Dr. Johanna Kaufmann, presenting author of a study on a next-gen COVID-19 vaccine that's administered intranasally, and Dr. Heather Yun, this year's IDSA program chair, who talks about emerging threats and trends in infectious disease.
What an extraordinary summer it's been, both in terms of local temperature and just climate change in general. We have seen an emergence of locally acquired malaria in several states across the United States and other vector-borne diseases. And you can look at it through temperature. You can look at it as a result of natural disasters, flooding. You can see it as a result of migration of different types of animals and insects and vectors as a result of all of these things. So we know that climate affects infectious disease transmission in a lot of different ways, and it's really not a hypothetical scenario for us. What's hot this year also includes artificial intelligence. It's really not a novel concept per se, but I think the immediacy of AI in everyday lives and the immediacy of AI really in medical care and what will that mean for us in infectious disease practice is something that, you know, even late adopters need to come to the table and start to think about and wrestle with. You know, in terms of studies that we're kind of highlighting and looking at with interest, we have a potential public health impact of bivalent respiratory syncytial virus prefusion maternal vaccine for prevention of RSV among U.S. infants. So this one essentially used a model, a cohort model, to try to evaluate what would be the clinical outcomes and the economic cost savings associated with administering this maternal vaccine among infants, really up to a year of age. You know, the results of this, at least, you know, what we're looking at in abstract form is that without the use of that vaccine, almost 50,000 hospitalizations and about 150,000 emergency department encounters would be projected to occur annually in the birth cohort of 3.7 million infants in the United States. So the vaccination would be projected to reduce hospitalizations by about 24,000, about 50,000 emergency department encounters, and about twice that many outpatient clinic visits, with very high decreases in direct medical costs, about $700 million. Another one that we're interested in, and this really has been born out of some of the science that matured a lot during the COVID epidemic, is titled Longitudinal Wastewater Surveillance for Endemic Respiratory Viruses, and its correlation with clinically confirmed cases in Calgary and Canada. And this one is looking at influenza A, influenza B, and respiratory syncytial virus, and just evaluated how well did that wastewater surveillance really correlate with clinical disease in that part of the world. And again, they found very, very high degree of correlation with these sewer sheds being positive for these viruses and the amount of disease activity in the community. So we think that's hot because this is really an emerging technology that allows us to, you know, further expand the power of epidemiologic surveillance, really in ways that we never could do without people reporting disease and going to the doctor and things like that before.
Cobiliv is a live attenuated viral vaccine, meaning it is essentially a version of the full virus that can infect and replicate to some degree at least, meaning that it is not just a component of the spike protein as in the currently authorized vaccines. There is obviously some synthetic engineering on the basis of Codagenix's platform technology that converts this pathogen, the full live replicating SARS-CoV-2 virus, into a safe vaccine. The second key component that is different in this vaccine than others is that it is intranasally delivered. So it is essentially a nose drop at this point in time. There are no needles that are required, which we believe can help with some of the sort of global health applications for this vaccine and improve equity. The study was actually run over the course of 2021 and 22. And at that time, participants in this trial were naive to other vaccinations. And one of the important inclusion criteria had been that they had to be negative, obviously, for COVID infection at the time of enrollment and had not been infected previously to their knowledge. So this is a primary series vaccination trial. It was a placebo-controlled trial that tested 3 different dose levels of the vaccine, and recipients received either 1 or 2 doses at each of these dose levels. The immunogenicity data that we will be presenting focuses on the highest dose group. We did induce antibodies. That is obviously the first readout that most other vaccines will be following. And we did see about 80% response rates over baseline by various measures of antibodies or neutralizing antibodies. However, we are focusing more specifically on the T cell compartment or the cellular immune response, where we have used 3 different methods to characterize the T cell response to vaccination. Importantly, all of these readouts focus on T cell responses against more than just the spike protein, again, for the reasons that I've mentioned before, that the spike is known to mutate quite a bit to evade those neutralizing antibodies that we've generated with other vaccines. But we have multiple measures that we have a high quality T cell response against not only spike, but nucleocapsid and several other proteins. So overall, this data shows that we have a robust induction of a broad immune response against multiple antigens that may apply if this holds true in a larger cohort study, that we may be able to induce a cross-variant reactive immune response. And we are obviously continuing our clinical evaluation of this vaccine in a variety of settings, including the booster or updated vaccine. We have not seen any severe adverse events. We have not seen frequencies of other reactogenic events at frequencies higher than placebo. So this was extremely well tolerated. And in particular, cardinal symptoms of primary COVID infection, for example, fever or loss of taste or smell, we did not observe at all using this attenuated virus. So we have multiple trials that are also looking at Covilev in a variety of different ways. So if we for 1 second stick with the primary series, there is currently a phase 2/3 trial ongoing with Covilev that compares efficacy against placebo in a trial sponsored by WHO. So that's part of their solidarity trial vaccines. But obviously, the booster situation is of interest to us. We have completed a phase 1 clinical trial in this booster setting, and are planning to do a phase 2b trial in this setting in support or with support of BARDA, as we recently announced.